Good morning and welcome to the Advertiser's live Q&A with Professor Nicola Spurrier, SA Health's Chief Public Health Officer, and the lady who is in charge of all of our health responses with COVID. Thank you very much for your time this morning, Professor. For people who don't know me, and you can see on the screen, my name is Andrew Huff. I'm a senior journalist here at the Advertiser and one of the paper's main COVID reporters. Today we are going to be talking a lot about different things to do with COVID, from vaccinations through to testing through to where to from here. But usual housekeeping, the Professor can't give personal advice or personal medical advice. She'll be talking in general terms. Please keep your questions coming. We've had a lot of questions from our readers already. So let's get started. Professor, good morning to you.
Good morning.
Well, let's start with a nice, easy question. How are we looking today with our cases?
A very good day for us. 0 cases as far as I've been informed.
Excellent. Well, that's very good news. But if we can move on to a more serious topic with New South Wales and Broken Hill, can you provide us an update that what's happened overnight with Broken Hill, please?
Yes, so Broken Hill was certainly a concern. We saw a wastewater test on Friday, late Friday, and when they do a test, they always repeat it and just check that it is indeed still positive. So it was a low detect on Friday night, and then New South Wales actually put it up and reported that, and were urging people to go and get COVID tested if they had any symptoms. So on the basis of that, we did close the border. We're very mindful of people that live on those close borders, and people in Broken Hill basically use all the services in South Australia because they're one of those very important border communities. So we had carved that out, and also Wentworth, but we've kind of had to make a move and require people coming from Broken Hill now to quarantine. So indeed, there was a positive case detected by New South Wales in Broken Hill, and we've followed up with that person. My understanding is they're actually fully vaccinated, and their partner had come back to South Australia, but had done all the right things, and in fact had been tested at the airport and was negative, and we've done follow-up testing, and indeed he remains still negative and will be in quarantine for the 14 days, and we'll keep monitoring his progress. But I guess it was a bit of a concern to us about where that person had picked up COVID, because there wasn't known to be COVID in Broken Hill, but there had been a number of funerals in I was just trying to think of the name of the town, and in a town between Broken Hill and Wellgate and Dubbo, and people will be aware that there have been cases in Dubbo. So the person did indeed attend that funeral, and I'm not entirely sure whether that might have been where the person picked up the virus or not, but we're very interested in working with New South Wales to understand better that situation there. But really, from a Broken Hill point of view, the most important thing for people in Broken Hill is to go and get tested if you have any symptoms. We know that the testing, when we had our own experience here when we call out for testing, that it can easily get overwhelmed, and we have offered to New South Wales Health if they'd like to put some of the samples through SA pathology, because at the moment we've got quite a good capacity for testing here.
Thank you, Professor. I'm sorry, I'm having a couple of gremlins with my computer, so you were cutting in and out, and I'm hoping that there's no issues with our audience. So if there is, I apologise. The gremlins always seem to come at the most inopportune time. Apologies if you in your answer you touched on this. Have we had any further cases in Broken Hill overnight?
I was alerted directly by New South Wales Health yesterday about this case, and I haven't received any further information today, so I'm assuming not, but they will do their update at the standard 11 o'clock. Now, they are very, very busy because they have a big job cut out for them, but I'm just assuming, because I haven't had any personal communication, that we haven't had any further cases picked up.
That's good. And so this patient is a man, female, and how old are they roughly?
So this is a patient that is in a case that's in New South Wales, so we don't have all of those details, but I can say that a person's partner has travelled back to South Australia because that's where he lives, and he's tested negative.
Okay.
And he's in quarantine. So there's no risk to our community from that.
Okay, so there is no risk, but obviously you're concerned about Broken Hill. For our readers that might not understand, say, the Delta strain, why are you so concerned, firstly, about it, A, being in Broken Hill, and B, about the Delta strain?
Yeah, so obviously Broken Hill is right on our border, and what people will have seen in New South Wales is it didn't take very long for that outbreak to not stay just in the inner part of Sydney, even though they have very significant lockdowns. And it has travelled because I've said in press conferences, the virus travels when we travel. So when people move, the virus is able to move. And so that's why when we try and contain the virus, it's so important that we call it a lockdown, but it's basically just trying to stop people moving. But you can see that there are reasons for people to need to move. And so it has spread outside of Sydney. And you can see that the western part of New South Wales has had significant number of cases, and unfortunately that's been in their Aboriginal communities as well. And of course, Aboriginal people unfortunately do have higher rates of chronic disease, and we're always very concerned when we see COVID in that particular community. And my thoughts are really with those people there in Dubbo and Walgett, and I'm very much hoping that things are going to improve there for them. So in terms of the Delta variant, it is much more transmissible. So it means that if you have the virus, it's much more easily transmitted to other people. Now, there's a few reasons for that. One is when they've looked at the viral load, or how much virus people have when they have the Delta strain actually in their nose and mouth. There's a lot more of the virus there. So it means it's easier for that virus to then get into the atmosphere and pass on to other people. But the other thing about, so if it's more transmissible or more easily transmitted, then we know that one person with COVID, with Delta, can give it to a lot more people than we knew with the Wuhan strain. So we used to know last year it was approximately 2.5 people that one person could infect with the Wuhan strain. It's estimated, if we didn't have any restrictions and didn't have masks and we just had Delta, that one person would pass it on to 8 other people. And those 8 other people would pass it on to 8 other people. And you can imagine if that kept going, it would just whoosh up and you would have a really big outbreak really, really quickly. So what you've seen in New South Wales is certainly their lockdown has damped that down. If they hadn't had that, it would have just skyrocketed and it would have been really out of control. So it's very difficult in New South Wales at the moment because of this increase in transmissibility. But the other thing about Delta is it can cause more severe disease. So you probably people have seen that there's quite a large number of people admitted to hospital, and that is including young people as well. So there's some evidence, some early evidence that children, because we didn't think too much and worry too much about kids last year, we certainly knew that they didn't transmit the virus as much as older people, but that's quite different, I think, with Delta, and we're seeing younger people getting sick as well. And what we do know is when we look at modelling is if you get that Delta strain in your community with community transmission when there's no linking of cases, it is really, really difficult to get rid of it. Which is why when we had the Modbury outbreak, people might go, oh my God, why have we shut down? We've only just had a couple of cases. If you don't get on top of it and throw everything at it, and my team's probably still trying to recover. It was a lot of work to do all of that contact tracing, but it was worth it because if it gets into your community, it is very difficult to get rid of it. So it's a very serious situation for New South Wales, and indeed Victoria and Northern Territory went into a lockdown very quickly just with the one case because they didn't want to go down that same path. And we're in this situation until we can get everybody vaccinated. So we've got a short period of time, and I'm feeling the pressure. I can see what's happening in New South Wales, and, you know, there's talk about reopening the international borders, but we've already got Delta in the country, and this is the time to get on and get vaccinated. If you're in the 60 above and you're thinking, I'll wait till Pfizer, please, please do not do that. We are so close to being part of this national outbreak. You know, we can only do so much keeping our borders shut. When we get cases here, you're not going to get time to go and get vaccinated, and you need the 2 doses. You're not going to have time. You have to go and get it now. Please don't wait.
So I guess, Professor, we've had a lot of questions about vaccination, and we might segue quite nicely into that now. A lot of questions about the supply and the access. And I guess let's start with a question from Christine. Why you're imploring people to get vaccinated, yet people weren't able to access it, and there's still a lot of hesitancy with AstraZeneca. Is that hesitancy with AstraZeneca justified?
Look, I'd go back to the ATAGI advice, and we need to look at that advice in terms of whether we're in an outbreak or not. Now, South Australians probably don't think you're in an outbreak, but we have a serious outbreak in 2 bordering states. And so, you know, you really need to be thinking about that context. A couple of months ago, we had the luxury of time. And so we had the luxury of saying it's preferred for 60, Pfizer's preferred for 60 and below because of this rare clotting disorder. But we're in quite a different situation now. And I really liked Brett Sutton, the Chief Health Officer from Victoria. I really liked one of his, and I'll quote from him. And he said, the best vaccine for you is the vaccine that's now available for you. So we do have AstraZeneca available. There is that, and like basically any script that I write for a patient, there's always some chance of a rare side effect. But particularly in 60 and up, particularly as you get older, the risk of that side effect is so tiny. But the risk of getting COVID now in our country, and particularly with Delta, because it is so severe, the disease, if you're not vaccinated, then you really have no protection. And I just don't want people in South Australia getting sick. You know, it's so preventable, and we have that opportunity now to get in and get the vaccine. Now, I know people understand that the Commonwealth are the ones that have got this, that organise the supply of vaccines, and they've been doing their best to try and see if they can get more Pfizer. But we've got limited supplies of Pfizer, and I was very keen to open it up to 16 and up, because if we don't vaccinate our whole population, we're going to be in trouble. And it's that 16 to 30, 40-year-olds that actually have the most contacts. So when you look at, we've looked at how many contacts that people have, and it's that age group, because they're the ones that are getting out and about at uni or at work. And then once you've had children, you tend to socialise more with other families. So those are the ones that have more contacts. And so it was really critical for us that we can now offer vaccine to those people as well.
So as a follow-up, Professor, should AstraZeneca, or should the advice, what is your view on the advice about offering AstraZeneca to people aged under 60 to help with that vaccinating the whole population? Should that advice now change?
Well, I'm not the vaccine expert, so I will always refer to ATAGI's advice, and ATAGI has produced some more advice talking about the situation when you're in an outbreak, and so they're not changing the advice that Pfizer is preferred, but when you're in an outbreak and you haven't got Pfizer, you're going to have AstraZeneca. But I think it's very important that people have had the appropriate counselling by a health professional to look out, so that they know what to look out for in terms of that very, very rare clotting disease. And we know that when we've had cases, and we've picked up cases in South Australia and other parts of Australia, that if you can pick it up quickly, get it diagnosed and treated, and it's treatable, then it's not the end of the world. So it is important that people have that counselling. So we were not initially providing AstraZeneca in our state-run clinics for younger people, but we are now allowing that, and that they will have a longer time to have the vaccine, because it allows a senior nurse and a senior pharmacist to go through that counselling and give that important health advice. I mean, I'm so pleased that I've got my husband vaccinated. He had AstraZeneca, and my mum's vaccinated. She had AstraZeneca. No problems whatsoever. And I am so pleased, as my husband recently had a second dose, that he is now fully covered, and I don't have to worry about him personally.
We'll get to your family a little bit later, if that's okay, Professor. But Steve just asked, therefore, do you regret, or is there any regret about not being able to offer the 16 to 39-year-old cohort up until Monday? And should that have happened any earlier? He also asks, and can you mix the two doses, AstraZeneca and Pfizer?
Well, look, the Commonwealth still, their rollout still doesn't allow 16 and up to be vaccinated. So actually South Australia has gone a little bit ahead of things, and we're able to do that, but it is dependent, of course, on the supplies that we're getting from the Commonwealth. And you might recall we opened up to the regions for 16 and up quite a long time ago, and I felt that older people have had the opportunity for quite some time now to get vaccinated, and it's about time we do open up those bookings. Now, it doesn't mean we've suddenly got a larger supply. We're very lucky. We did get 47,000 additional doses because the Commonwealth could get that from Poland, so that's really good, and that's now coming. It'll come into our system, but at least people can get on and book their vaccine appointment.
Based on from that, Professor, this Paul asks, when do the health projections show we will reach 70 and 80% vaccination coverage? And what difference will that make to your advice on restrictions, including lockdowns, masks, home gatherings, and interstate travel?
Andrew, I just remember I didn't answer the second question about mixing the doses. Do you
Right.
want me to
sure,
talk about that?
Okay, let me do that. Answer that, and then we'll come back.
So there's theoretically you should be able to have a mixture of doses. However, all of the trials with that in that regard have not been completed yet, and there was some concerns with having AstraZeneca followed by Pfizer, because there was quite a strong immune response, and so people did get quite a few of those localized short-term side effects, but you certainly got a good immune response. I was on a webinar recently where they presented some of that research, so again, this would be something that ATAGI will be looking at longer term, but at the moment we're really basically following ATAGI's advice based on the evidence that we've got today.
And therefore, leading into my my other question.
I think I can remember it. So you wanted to, somebody's asked about when will we get to 70%, when will we get to 80%? And that's a useful question because National Cabinet has put a plan together looking at the phased a certain number of phases when we get to 70 and we get to 80. Now, for South Australia, we're estimating we'll get to 70 in November and 80% in December, and that's two doses, so to be fully vaccinated. Now, that could speed up because we get more vaccine in, and that's one of the reasons we wanted to open up the booking so that at least we've got people booking, maybe we'll get there quicker. Now, those are the vaccine thresholds that have been put together for National Cabinet to make some other decisions around the international borders and such like, and how we would manage quarantine once we've got a certain percentage of the population vaccinated. But I just wanted to say that I've never been able to predict the future, and a lot of the time I spend thinking about different potential scenarios and looking at experiences elsewhere in the world. And just recently, because if you look at the countries that are very highly vaccinated, such as Israel and Iceland's quite a good sort of equivalent to us in a way, because they managed COVID in a very similar way. They put their international borders in place. They didn't didn't overrun their healthcare system, and they did manage it particularly well. They did good contact tracing and such like. Now, they have very high rates of vaccination, as does Israel. It's above 70% of their population in Iceland, and they lifted all of their restrictions basically. But what they found with the Delta strain is that they have started to see more cases. Now, those people that are vaccinated are generally, they don't get that sick and they don't end up in hospital, but they're still getting this sort of outbreak happening. And so they've brought in some mask wearing and also some restrictions and caps on some of their public activities, some of those higher risk activities. And there's probably two things here. One is the Delta variant, because it's so transmissible, but also we don't know much about how long the vaccine lasts for. So if I've had the vaccine, can't remember, it was end of February, March, then it's some months now since I've had my 2 doses, and my body may not have such a strong antibody response as it would have done earlier on. Now, some vaccines are fabulous. They last a lifetime, like hepatitis B vaccine is an excellent vaccine. It lasts for a long time. You don't need a booster. But vaccines such as your tetanus, people will remember that they have to get a tetanus booster from time to time. And we just don't know with the mRNA, with Pfizer or AstraZeneca, whether we'll need boosters or not. And there's a little bit of discussion now around when that will be. So I know I haven't quite perhaps answered the question, but we've got these targets of 70 and 80%, but there's other things that we're going to have to take into account. I'm definitely not wanting to have lockdowns. Are hideous, and one of the things I really don't like as well is having borders between states, because then we have to set up our exemption process and it's pretty stressful for everybody. And it's much nicer if we can have free flow around our country. So we're definitely looking at not having to have those sorts of heavy public health restrictions, but it may be that we're going to have other sorts of public health activities such as the mask wearing and certainly looking at those sort of activities such as nightclubs and such like, which can be the super spreading events.
So I'm not. You must be seeing my questions here, Professor, because Matt asks, what happens when we get to 80%? Will we ensure that there's no more lockdowns?
Yeah, well, nothing in medicine's 100%. But what we would be definitely thinking is that what the Doherty modelling did, and the Doherty's fabulous, this group of modellers, and that some of the people that do the modelling are actually in South Australia as well. So it's a national consortium that are putting this modelling together, and they were looking at 70 and 80%, and they were looking at the reproduction number of the Delta variant and trying to get it down under 1 with a combination of vaccination, some public health measures and contact tracing. So I know that it may be a little bit of dense reading, but Jodie McVernon did a very good press conference where she explained the modelling. And I think if people do have a chance to look that up, it's worth looking at, because it's not just the vaccine. The vaccine's one part of it, but there are other things that we'll need to keep doing, and that includes getting tested and us doing contact tracing. Now, we might do the contact tracing in a slightly different way, and we're working through that at AHPPC, exactly what that might mean. Because we'll be in a different sort of situation where we've got this impact of the vaccine on top of the other public health measures.
So what, just following on from that sounds reasonably interesting. What sort of contact tracing, what sort of methods are you looking at AHPPC?
Yeah, so the way we do this at the moment is we want to get rid of every single last case and be down at 0 because we don't have enough people vaccinated. And so we use the QR codes, which that has been a real game changer. That's been really helpful because it means that we can get hold of a lot more people who have been exposed, particularly given the Delta variant. And we make sure that everybody who's been exposed is asked to quarantine, and also if it's at higher risk and things are moving very quickly, we ask their family to quarantine with them, because what we're finding and what you can see in other states is by the time they get to one person, they've already passed on to the family who have then been out and about. So that's our double bagging that we do in South Australia. So then if you're looking at other ways of, it's not really other ways of contact tracing, but other models of contact tracing, what we do have is the capacity to see when we look at close contacts whether they've been vaccinated or not. So our priority would be getting on to people who have not been vaccinated, because those people are more likely to transmit the disease on, whereas people who have been vaccinated, whilst they can transmit the disease, they're less likely. So you can see when you're trying to do something in a different environment, you might have different ways of prioritising the process. I don't think there'll be a difference in the 14 days of quarantine though, because the vaccine doesn't change at all the incubation period of the virus. That was a very serious gremlin, Andrew. You just froze for a long time.
I'm terribly sorry, Professor, honestly. William asks, will fully vaccinated people get more freedoms earlier than unvaccinated people or those who, say, refuse to take the vaccinations?
I always have a population perspective and thinking about the whole population. And so we know that people who are vaccinated have a reduced risk of getting infected, but it's not a zero risk. And also they can transmit the infection. So that was quite clear in Cairns recently, where somebody who was fully vaccinated was able to pass that on to somebody else, and they became infected. So at the moment, because we don't have a fully vaccinated population, no, people will not be able to do things differently at this point in time, but it's because we don't have that high rate of vaccination across our population. And so if that person did pass the disease on, it would still take off.
So Emily asks, what plans do you have in place, Professor, for when we do reach 70 and 80%? What can we look forward to? What can South Australia expect when we get to 70 and 80%?
So I think we should be looking forward to hopefully not having to have any statewide lockdowns, and of course that would be fantastic. And we would also be expecting that other states are also at high vaccination rates, and therefore we could look at more free travel and not have to have those borders in place. Those are the two big ones. But the things that we might need to keep going on with, we may need to continue with mask wearing, and we will be still looking at the high risk areas, such as where we know that there are super spreading events and where there's large numbers of people coming together.
So Claire asks, fast forward 12 months in South Australia, what if you could put your crystal ball on for a minute and look into that? What are we sort of looking at, in terms of those restrictions? What's your sort of thinking process with that? And could you paint a picture for our readers about what 70 and 80% vaccination looks like over the next 12 months?
Look, it's very difficult looking out that far, and what we've tended to do is look at different potential scenarios, because you're better to plan for a whole lot of different scenarios. And so there's not going to be, I can't say, there's 80% chance going to be like this or 50% chance going to be like that. I think we could look at a whole lot of plausible scenarios, and that's going to be dependent on the vaccination status of the world, because we've got the Delta variant at the moment, but we don't know if we're going to get another variant. I've already talked about waning immunity and what that will mean. The other thing is we should have vaccination approved for children, and it's going to be important when we look at the whole population, because of course children can transmit transmitted as well, and kids can get sick from COVID. So at some point, I'm hoping that we will have the trials completed for 6 months to 11-year-olds, and then we'll need to be looking at kids getting vaccinated, and we'll see what the rates are like then. So there's quite a few things that we have to put in the mix. If we go back to the Doherty modelling, to get the reproduction number under 1, which means we don't have an epidemic that takes off, we will need some public health measures of some sort. The Doherty modelling used a package of public health restrictions that were basically what New South Wales and Victoria had at certain points at time. What I don't have is modelling putting in our package of restrictions, which are a little bit different. And Doherty have had a lot of work to do for National Cabinet, because that's who's has tasked that they've been tasked by National Cabinet to do this for the whole country. But at some point, it would be nice to have that. Now, if you have a look at that, the work that the Doherty have done, there is a package of public health restrictions called low or baseline, low, medium and high. The high is the tightest lockdown equivalent, which is what's happening in Victoria at the moment with a curfew. And what we can see is when we get to 80% vaccination based on that modelling, we don't need to have that sort of public health restriction. But there are other packages which are milder than that, and they are wearing masks, having some density requirements, particularly in those high-risk activities. So I'm sorry I can't be definitive, because it's just impossible to be definitive. I just wanted to make one other point that people might not have thought about, but something that it's front and center of my mind. So when we talk about 70% of the population being vaccinated, or 80% or 90%, there's an assumption that is across the whole population. But what we know from other health conditions and other vaccination programs is there's sometimes groups who are not highly vaccinated. And so we might find that there are parts of South Australia where we have very, very high vaccination rates, might be more like 95%. And then we might have other pockets which are only as low as 30 or 40%. And then on average, it looks like 70 or 80%. But that doesn't mean that that pocket who's got a low vaccination rate might not get the disease and then have a lot of trouble for us to get on top of that outbreak in that particular population because of the low vaccination rates. So that's one of the things, and we're very mindful of. We've got maps up to see what the vaccination rates are like across our state to make sure that everybody is able to access the vaccine. And you could say, look, everybody should be able to. There's a booking system and such like, but we all lead different lives. Some people have really complicated lives, and it's not the first thing on their top of their priority list at the beginning of a day to go and book their vaccination. And because they've got other things that they're having to deal with in their lives. And so we're looking at ways that we can support every South Australian to be able to get vaccinated, regardless of all of those other complications.
We'll get to masks in a minute, Professor, because we're getting a lot of questions about masks. But just following on from that, is there any concerns, or what do you say to people that get a booking and then have to cancel it and then, don't rebook? What do you say to them?
Look, I just think it's important to get on and rebook it. There's lots of different ways you can get vaccinated with the GPs that can do the vaccine, and then we've got our mass vaccination clinics. Because we've still got the supply issue, and it's been we've managed to do this in South Australia in our mass vaccination clinics through a booking system, but it may be that we do need to have walk-ins at some point so that people who haven't got a booking are able to come and get the vaccine regardless. You've seen, though, how difficult that can become interstate if you don't have a booking system, because you end up with long queues and such like. So I think the booking system is really good because if you've gone, I don't know where you got vaccinated, Andrew, but maybe you could share your experience with your listeners. Certainly when I've gone to the mass vaccination hubs, it's a very well-controlled, calm environment where people are just coming in, talking to the professionals, getting their vaccine and then out again. Certainly my husband had an excellent experience.
Well, at the risk of being kind to SA Health, Professor, yes, I am fully vaccinated. I've had Pfizer, and I went out to the Playford Clinic out north to go somewhere different. I'd been to Wayville many times to go and see you and the Premier and others, and I found my experience excellent. It was seamless. It was no problems. I had no complications. I had a slightly sore arm for a day or so. It felt like I'd been had a dead arm from playing basketball, but no, I had no complications whatsoever, and I would also urge people to go get vaccinated. It was easy, and I feel very confident now that I'm fully vaccinated. So thank you very much for putting me on the spot, Professor. But masks. You said before that, and we're getting a ton of questions on this. You said before that when we get to 70 and 80%, hopefully no more lockdowns and those very draconian restrictions. But you flagged the use of masks. Why? Why has your advice changed from last year when you said masks weren't necessary? And why will masks still have to be necessary when the majority of the population are still vaccinated?
Yeah, so it's a really good question. And this is, again, trying to pull together bits of information that we're obtaining from other countries, and also the fact that we've got the Delta variant. Unfortunately, the Delta has sort of supercharged this whole pandemic, and it is quite different to where we were last year with the Wuhan strain. That caused devastation across many countries, and we were able to control it here, and we didn't need to wear masks, but the research really showed that with that Wuhan variant, it was mostly droplet spread. So you didn't produce so much a virus particle that it would hang around in the air afterwards. But we know now with the Delta, that's not the case. And so we also last year, really early on, and I think people are aware of this, is we didn't have a good supply of masks in Australia, because masks are mostly manufactured in China, and of course China was having its own problems with COVID, and the whole world was calling out for masks. Now we solved that problem, and we've got a fabulous supply of masks now, and I guess more research has gone by. So it's really looking at what the experience has been in some other countries who have got very high vaccination rates but are starting to see increases in numbers of cases. And I think it's important for people to know that the vaccine is absolutely your best individual protection against COVID, and it will be a game changer for Australia to get up. Basically, if we don't get vaccinated as a country, we're just going to go nowhere. We're going to be in really big trouble. So it's absolutely critical that we get those vaccination numbers up and as quickly as we possibly can. But what I'm flagging is from the information that we've got overseas and the modelling that's been done by the Doherty, we're likely to still require some public health restrictions. Now, masks actually can be quite effective, and they are good because you can still go about and have the economy and have restaurants and and have people able to get around and do what they need to do, but you've got another sort of control measure in place. So when I think about, if I maybe give as example, when I think about public health, and I always think of the population as a patient really, but it's the whole population. If I see a child with asthma, then there will be certain things that I'll do in terms of the management. So we might recommend a preventive medication. We might recommend a reliever when they get symptoms. We'll write a asthma management plan in case there's an acute attack. And then we might look at whether they've got any allergies and look at dust mite and look at controlling dust mite in that child's environment. The same thing is with population health and with a pandemic. There's not just one thing that you need to do. There's a whole lot of different controls. So one of those really important ones that we've now got is the vaccine, but it's likely that we're going to need some other controls, and that will include some requirement for quarantining if people are coming from high-risk countries or where there's another variant, some requirements for there's some local public health controls in terms of COVID safety, QR scanning, and some masks. And then there's, protecting our vulnerable communities, such as what we do in the hospitals and what we do in aged care, for example. So there's a whole, and then the last one I should say is contact tracing, so keeping up our capability to do the contact tracing. So it's a suite of controls. It's not just one thing or another.
Yeah, sure. And before I get back to the reader questions, so therefore, are we looking at, do you expect restrictions to stay for density, public activities, crowd numbers, and the like?
Look, I think we're going to need to have some visibility over those sorts of things. I can't tell you definitive because we're still looking and trying to garner information about how things have gone in other countries which are very well vaccinated. That question I posed about having a group in your community who are not well vaccinated is being played out in the US, where some states the vaccination rate is very, very low, whereas the rest of the US it's very high, but people are still mixing and it's still, driving those outbreaks. So there's quite a number of things that you need to take into account.
Sure. And therefore, with masks, where do you envisage you needing to wear masks in the future?
Well, if you think about it logically, it's when you're going out in public space and you're mixing with other people that you don't know. So generally what we're doing at the moment, and of course masks are a bit of a pain in the neck, but inconvenient. But we've been very lucky in Australia because we've got away with not having the pandemic for so long, and we feel like we've had the pandemic, but it's not like countries where it has just come washing through. And those countries have been wearing masks for a long, long, long period of time. Now, we've just had a little bit on and off with it, but it's certainly with the Delta variant and where we are at the moment, I think it's really helpful. And I have to say, South Australians are just amazing. They get on with things and they get on board with things. And, I look out my window down to Rundle Mall and it does fill me with some comfort to see people that are protecting themselves. Again, also, when I see the vaccination rates going up, and I've just been given the latest, we've got this, if you look at people 16 and over, and of course those are the people that can be vaccinated, there's 26% of people in South Australia are fully vaccinated, have 2 doses. Now that's pretty good, but given our supply chain and such like, well done. And there's around 46% who have had 1 dose of vaccine. And many of those will be getting their second dose in 3 weeks, so that 26% will go up fairly quickly.
I've got actually a young person's question. I've got a couple of young people's questions coming, Professor, but the first one is from Gus, who's 14, and he would like to know how long, following on from our mask conversation, how long do you envisage masks to stay in schools and for school children to have to wear them on campus for?
Another good question. I just can't give you a definitive, Gus, that we know from what we can see we've got such a big risk interstate at the moment in New South Wales and also Victoria to some extent. And if you have been following the news, I'm not sure if you have been, but there's many schools that have been impacted. So it's very clear that this can be transmitted quickly amongst students. That wasn't what we found with the virus last year with that Wuhan strain. And even up in Queensland, in the Indooroopilly area, where a school's been involved, they had so many kids that had passed it on, and there were quite a number of schools because they were all doing, I think there was a karate lesson, and they had a lot of kids at that, and it all became cases, and then they went to their other schools. So I know that it is inconvenient, but you know what? I actually think young people are pretty sensible and are pretty resilient, and I think they've just got on with what they need to do, which is the feedback I've had from my 13-year-old at any rate.
Can we, just as a depth into that a little bit, Professor, at Transition Committee, was there any discussions about timeframes with masks? And I appreciate you don't go into confidential conversations, but are we looking at sort of the next fortnight with masks? Are we talking in the next month? Are we talking 3 months or long-term, medium-term? What sort of timeframe could we be
I think it'll be longer rather than shorter, and it's because of the risk in New South Wales. If we didn't have that risk, we wouldn't be needing to do that.
Just on restrictions, we've had a reader question come in from Abraham, who had a situation where his daughter had to go to hospital at the weekend to the Women's and Children's, and there were restrictions on the number of parents that could go to be with their child in the emergency department. And he was wanting to know is, as he came out of the hospital, he saw a lot of people leaving the football. And I guess they are slightly different issues, but, you know, these are what the public are talking about. Are rules currently on the number and the restrictions and caps on people visiting hospital, is that something that will be looked at? And is it fair that there are caps on people going to those locations, yet we could have crowds in other parts of the community?
Yeah, so the visitor restriction is a hospital policy that they put in place, and the reason for doing it is that it's because of the vulnerability of their patients. So they've got people admitted in that hospital who have very poor immune system functioning because they're on chemotherapy or they've got chronic diseases, so incredibly vulnerable. So that's the reason why when we're at a situation at the moment where there's a risk in New South Wales, that the hospital will put in place those policies. So when you look across to the football, it's not generally, it is not a venue where you've got a large number of people that are sick. And the other thing with the football is it is a very structured event, and so we know and Adelaide Oval know exactly where people are and where they sit. When I've gone there to review their protocols, I've gone up into their they have a police and security observation area, and they have the most amazing CCTV, which has been very helpful when, and I know they've done this at the MCG in Victoria, when they have had a case, they can go back and they can actually find the person and see who they went past and where they went, so that they can do that more detailed contact tracing. Now, we don't have a system like that in our hospitals, so it's completely different sort of setup where you've got staff going between different wards and doing, if you've got a patient in an operating suite and then they go back to post-op and then they go to the ward. So there's a lot of quite complex mixing in a hospital, plus you've got the vulnerability of your patient. So quite a different setting, but a really good question to ask.
And I guess this is another question, football related, and this is a young person's question. This is from Charlotte, who is 10, and she asks, why do you allow football crowds to go ahead, yet the Royal Show can't go ahead this year?
Yeah, it's another really good question. So when you look at the football, people are generally seated. And so you've got when you move in and then when you come out. But when you're actually in watching the game, people have to be seated. So we've got rules in place to say that you can't go and stand in the, I don't know if you've been much to the football. I seem to have been more than I probably need to. But anyway, you've got the concourse and where people can buy food. And there are rules in place, part of their COVID management plan, that people can't stand and consume their food there because we don't want that mingling. We want them to go and sit down in their seat. And also that at the moment there's going to be masks at all times. Of course, when you're eating, you'll take your mask off, the same in a restaurant. And we have significantly reduced the numbers in the football crowds as well at this point in time because of the risk. Now, the Royal Show is completely different in terms of being a very open event, and we call that a free-flowing event. So if you remember going to the show, you get in and then you might go and go on the rides, and then you might go around the back and have a look at some of the pavilions, and then you might go out and see the animals and then end up with the show bag. And so there's a large number of people moving around at different points in time, and there's a large number of people that therefore can come in contact with each other. So it's really quite different from an infectious disease perspective because of the smaller number of contact points that you have at the football compared to what you would have at the Royal Show. So I really love the Royal Show. I feel so sad about that one. And we tried to work out how we could do something something which was a bit smaller, and we'd have smaller numbers of people and we'd separate off different parts of the show, but it just didn't seem to be possible. Let's just hope that we can have that going ahead. I did wonder if we could postpone it until we had those higher vaccination rates coming in later in the year. But because the show is an agricultural or a rural show, it's dependent on when the farmers are ready to show off their produce and show off their cattle and stock and such like. And also, I'm not a farmer, but I'm sure there are things that farmers are doing in January, February, which are probably quite critical, and it wouldn't be the right time for them to have that show. So it didn't seem possible to postpone it, unfortunately. So if you want an answer to this, if you get asked at school, it's because it's a free-flowing event, not a seated event.
A free-flowing event, not a seated event. Fantastic. Professor, we talk a lot about restrictions and vaccinations, and I think one of the, and you've spoken about this previously, about mental health and actually how the community is feeling about this. You and I, we live and breathe this every day, and it's our jobs to do that, but there's a lot of people who don't, who are, I think it's fair to say, very sick and tired of the restrictions and the lockdowns and all the uncertainty. Are you concerned about the long-term, this is from Rebecca, are you concerned about the long-term mental health aspects of impacts of the pandemic, especially for workers in hard-hit industries and our children?
Yeah, absolutely. I think it's absolutely concerned about it, and this is a worldwide phenomena. There are such high rates of anxiety and depression in young people, and it's about that uncertainty. What is it going to be like for my future? So we need to keep thinking, be hopeful, and think of all the positives. And I always think of the businesses that have had to close through the pandemic. Now, some businesses haven't been able to pivot. There are some people that have been able to rework out their business and try to pivot for the pandemic and so that it can continue into the future. But there will be long-term impacts on people's mental health. The other thing about in terms of mental health is people that have been in extended lockdowns for long periods of time, and that's why we've tried to get on top of things very quickly in South Australia so that people haven't been in that lockdown situation. But particularly people who are single and they're having to stay in their own home and they're not having that. We're as humans, we like to be with other people. We thrive when we are, vibrant communities and we come together and we're doing useful things together. And I think that really does have a significant impact on people. I suppose one silver lining is we do have the ability to talk to people as we're doing today in online, and hopefully people have used some of those technologies to be able to communicate and keep in contact with each other. There is, we do have and because we were so concerned about this and very early on in the pandemic, we do have a mental health support line. SA Health has set that up, and my office is right next to the chief psychiatrist, Dr. John Brayley's, and his team have worked very hard, and also through Wellbeing SA, to make sure that we do have those supports. So there's a 1-800 number, which you probably know, Andrew.
Yes, in fact, if you look at the bottom of the screen, Professor, we're actually got the number up there as part of our help with public health. So, for anyone who is, I guess, feeling very low or is struggling in the pandemic, please reach out. There's a lot of resources that have been placed into this. Having dealt, you and I have spoken about this a lot. People are not alone, and if you have any problems, please seek professional help, because there is always a better way to try and help things. Professor,
just on that, Andrew, because I know that sometimes it's difficult to get into psychologists. That's one profession that's been very, very busy throughout the pandemic. So you might say, there's a 1-800 number and sort of forget about it. But if you do feel like you want to talk to somebody about these sorts of things, about that uncertainty, just go and ring that number.
Yeah, terrific. And there's obviously Lifeline, and there's some other organisations as well. That, again, segues quite nicely, Professor, into another issue that you've been that health, I think is fair to say, has been grappling with, and that's about the exemption process. We have we've lots of reader questions about this and a lot of feedback from this. We've got some reports of people waiting up to 5 weeks for exemptions and people stranded interstate. Without going into specific examples, what is being done to cut the backlog, and what is the current backlog time-wise for people waiting to have their exemptions granted?
I can't give you an exact time frame, but as soon as we put a border in place, we then have this issue of exemptions, and generally it's not too bad, because if we say like Victoria, we still allow residents to come back and home quarantine, and also people who are relocating to our state. But because of the high rate of cases in New South Wales, and just to say, we've got the number of cases, but those are the ones that have been tested and diagnosed. So there's likely to be other people that have not been tested and diagnosed. So when we get that level, it is actually, in terms of us here in our state, and we don't have enough people vaccinated to just say, let the border open and let it come in. So we do have to be quite, we have to have it quite tight. So we want to make sure that if people do quarantine, that we and quarantine at home, and they're self-quarantining, when we're so concerned about that high rate of disease in New South Wales, and we've already had a lockdown with Modbury, that we do need to have the right system in place for home quarantine, and that's what our team has been working at. That means that we're not just relying on our Medi hotels to have people in quarantine, but that they can do it in another location. There's been a lot of work getting that up, and we need to make sure that we've got wraparound service like we've done with the Olympic athletes. But once we've, and that's happening this week, and was happening over the last couple of days, we should be able to move more promptly. But I guess from my perspective, I need to keep my vision on keeping South Australia safe as well. We've got to make sure we do it safely. When we don't have an outbreak in another state, so we went many months and we didn't really have too much in the way of borders, then we don't have an exemption process. So it's like having an outbreak here, and I have to stand up all the contact tracers, and we've got 15-hour waits to get a pathology test. It does take, even though we've got the system's ready to go, it does take a bit of time to crank it up. And we were not, any of us, expecting the outbreak that New South Wales has had. I don't think any of us were.
Do you think they'll, and we do have to wrap it up, Professor, I've got a couple of short fire questions in a minute. Do you think New South Wales are going to get on top of it?
Look, it's going to be very difficult. It's a very tricky situation for them at the moment. They're throwing everything at it. They are really pushing the vaccination rates up, which is fantastic. Their testing numbers are astronomical, and that it is a large population. And if I'm sure lots of you have all been to Sydney, and it's a very, very big city. So it's got challenges that I don't need to think about here in South Australia. It really is difficult, and you've got the Delta variant. So I would like to remain positive. One of the things, you can see that they've had success though. I mean, as I said, if they weren't successful, it would have gone way up really quickly, but it has been kept suppressed, and it's giving them time to get their population vaccinated.
Just a couple of final questions, Professor. The Medi Hotel breach of the Grand Chancellor, your views?
Well, I was very surprised about it, I must say. I think the guy showed a lot of ingenuity, but it's certainly important that we work out how it happened and make sure that it doesn't happen again.
Just a very quick personal question. There's a lot of personal questions that have come in from you. This one from Brooke I particularly enjoyed. Do you ever sleep?
I'm a really good sleeper. I go to bed early and I get up early, and it's not often I wake up at night. It's a very good skill to have. I've worked clinically in the hospital as a paediatrician, and you learn to fall off to sleep quickly because you're never sure what time you're going to be woken up overnight. It's a skill that we all need.
Yes, indeed. And Shane asks, his shed is tidy and his sock drawers immaculate. What's next, please?
Oh, Shane, I'm so proud of you. My husband's still working on his shed. Look, I don't know. I know some of my staff here have had their husbands painting, so there might be a few jobs around the house that you could perhaps order some paint in.
Terrific. Some yes/no answers when it comes to masks. Masks on public transport, staying or going?
Staying.
And this is, I guess this is longer term. Schools?
Uncertain at the moment.
Pubs and public venues?
With masks or?
With masks.
So at the moment it's with masks, but you can eat, obviously. You can't be in a pub and not be able to eat and drink. So my observation of South Australians is they're really sensible. They're putting their mask on when they go up and order at the bar, or they're going to the bathroom, and they're moving between places. And then when they're eating, of course, they're taking it off. So good job on that, and for the time being, staying.
Terrific. And I know we have to wrap up now, but just finally, is there anything that you feel that needs to be addressed to South Australians before you leave us?
Can I go back to the masks in schools? I said uncertain because I wasn't sure what long time frame you were using, Andrew. So for the time being, they're staying. If I can just clarify that.
Okay.
Yeah. So at the moment, a message for South Australians. Okay. One thing I would love is if people who get sick go and get tested, even those people who are vaccinated. Our testing rates are pretty low at the moment, and the only way we will know if we've got an incursion from New South Wales or Victoria or indeed any other state is if people are getting tested. So please don't forget to do that. And then, a positive note, let me see. I'm always so thrilled with working in South Australia. South Australians always do a great job. You always back us up here, and you're getting vaccinated. And probably the final thing, maybe those 60 and up who are waiting for Pfizer, maybe you could just go and get your AstraZeneca and really make me happy.
Terrific. Professor, profuse thanks to you and your team for talking to our readers today. I think it's been an incredibly insightful experience. For our readers, you can rewatch this conversation at our website and read more about it at advertiser.com.au, and we'll have a very comprehensive report of this chat today. Thank you again, Professor. Thank you, everyone, for listening, and good morning to you all.
Thank you, Andrew.